former minister, and founder of Something or Other Publishing, Wade Franson, is the host of Created in the Image of God, a series that examines the role of religion in society, from messianic returns to the emotive responses transmitted through our culture. Wade fearlessly addresses reality claims from all directions, objectively exploring their compatibility with Holy Scripture. Joining him is Daniel Sanderson, CEO of Planksiv, an international philosophy and cultural media outlet, helping emerging thought leaders with personal branding by co-creating organic content. Tonight's episode: Public Health and Computer Models.
Welcome, everybody, to another episode of Created in the Image of God. My name is Daniel Sanderson, and it's a pleasure to have you all back tonight. I have a special guest. I have a friend and a special guest. His name is Tyrone Keynes. That's right, Keynes. And if you're an economist, you know what that name means. Or do you? Well, on tonight's episode, we're going to find out if there's any relation. And we're going to talk faith, we're going to talk friendship, and we're going to talk a bunch of other things. So stay tuned, and we'll bring Ty in right after this commercial break.
Your story has the power to start a movement. Journalism is more than a tool for broadcasting news. It's an important way of fostering meaningful cultural relationships that create tangible change in our society. With our anthology Cultural Journalism, you can now do your part and make your mark. From expert writers to passionate amateur, everyone has a story to tell. Our aim is to promote equality, empathy, and create a safe space for different perspectives and interpretations of the world around us. Come join us today and break free from the toxic news cycle by submitting your story to Cultural Journalism at info@supellc.com.
Tyrone, how you doing?
Daniel, it is great to be on the show. Now, I have to add, this is the first time I've been on a faith-based live stream. So I'm excited, a little bit nervous, slightly apprehensive, but I'm ready to go forth into the deep end. And
okay, here's the thing. As the secular person, as one of two secular people in the room, it's kind of ironic that we're doing a religious show in a way, right? I mean, I mean, it's very interesting. But what I would say is that for all the faith-based listeners out there, I would say that Ty's kind of primed for the picking, and I'll tell you why. He led with faith. He said, "Hey, you know what? I just want to." He declared up front, right? And I think that's something that the faithful love to do. They're kind of proud. They just come out and say it. Would you agree?
I agree. And I want to add, actually, I've watched many episodes of this show because I know you, Daniel. I was aware of this show. And I like that it mixes in a healthy dose of science. Like, I've seen previous guest doctors, et cetera, et cetera. So yeah. I think there is a unity out there to, join, the faith-based community and the scientific community and make some sort of consensus on certain issues. I think that's a possibility.
Aha, perfect. You just gave me an excellent opportunity to talk about your model, right? So I want to read this part of Ty's bio. It's really, I'm not even going to fake that I don't read. When I do read, I'm going to read it, okay? So it was written like this. So here it goes. Using systems thinking to understand the world around us, his model entitled A Feedback Perspective, Susceptible-Infected-Recovered Social Stress Model was presented at the 2022 System Dynamics Conference to explore the adherence to non-pharmaceutical interventions and the subsequent resistance to government policies. I think everybody knows where this is going. Exogenous lockdown orders in the model are simulated in real time to illustrate the endogenous public behavior and the social stress caused by mandates. Okay, so when I read that, Ty, what are you thinking of other than the fact that yes, you were the creator of this model? Does it fill you with a sense of pride? Like, what do you hear when you hear that statement?
Oh, definitely. There's a sense of pride. It was my first major project using system dynamics. And for anybody listening, system dynamics is a mathematical modeling technique that is applied to a user graphical interface. So you can view graphs and view the model in real time. So that's what system dynamics is. Did it make me proud? Yeah, I was at the International System Dynamics Conference. So the best of the best, the World Series of system dynamics, you could say. So definitely proud. And the model itself is robust. I could run it today and get the results, predictive results that is desired out of such a model to policymakers.
Ty, could you tell me how important is a formalized education in a learning journey like that you've discovered? Like, what would you say to people that would want to think like you think or discover modeling as you have? What would you say to them? Is it an easy thing to do, or?
Well, first and foremost, if you're slightly interested, the first route you take is not a 4-year degree. The first route you take is exploration, and we live in the age of the internet. You explore, and you find out if you're passionate about it. You create models. In this situation, you create models of anything. It could be the economy, it could be COVID-19, it could be a supply chain model. And see if you're passionate about it. You can formalize yourselves. For instance, WPI provides, which is a university down in the States, a master's program, and a PhD program in system dynamics. Same with the University of Bergen. If you're willing to go to Norway, you can get your PhD there. But it's not necessary. Like, I do not have a degree in system dynamics. And I was at the International System Dynamic Conference. I guess I'm in a unique position that I know Steve Keynes, who you know as well, a fairly famous heterodox economist. So I've had the ability to network with his network and get myself out there. So long answer, if you're interested in or you think you're interested in something like this or any academic field, find out if you have a passion for it first. And a passion might be, instead of spending time with your wife and kids after work, you're reading academic papers because you can't stop. It's addictive. If you're into system dynamics and modeling, you're building models on your weekends for 12 hours a day. Find out if it's a passion. I don't shun going to a university to formalize yourself, but also in this day and age, it's not necessary. It's not. It's really, what difference do you want to make on this planet? Do you want to have the accolades of your fellow academics and write papers and trade them back and forth? Or do you want to affect policy change in the real world?
Yeah, that's great. That's great. And I know, speaking of Steve Keynes, we've got some tentative agreements between Steve and the show organizers that he will also make an appearance. So I'm really excited about that. I'm thinking that your advice is really honest, and I think it's going to be well received by our audience, right? And it rings true with me as well. I have no formal training as a philosopher, but publicly I identify as a philosopher, I guess you'd say, right? And you have to think to yourself, well, why is that? How did you get there? Well, it's a passion, I suppose, right? So I like that we've got that in common. So tell me about the COVID model that you developed. I mean, I know that you kind of sprung it on Steve, and I want to hear that story from you, right? Like, what were you going through when you like, how did you envision the moment when you're going to build this thing and then present it to them, right? Because it's kind of, was that part of the plan? Like you wanted to do that, or when did you know?
No, so by the time I started building it, I had been building system dynamic models for about 4 years at that point. And mainly I started the model just out of interest because we were in the thick of the pandemic, and I wanted a greater understanding of where we were going to go and what policy options were available to shorten the duration of the situation we were in. When it comes to showing Steve, there was no plan. Now, you had a show called COVID and Climate Correlations.
Yes, I did.
Which I watched and I really quite enjoyed. So I was a religious watcher. So you'd gone to a live format like we're doing here. And so I joined, and it was an opportunity for me. I had never spoken to Steve Keynes. I'd followed him for 4 or 5 years by that point and knew him inside and out, but had never reached out. And he had methods to reach out to him through his Patreon, on Twitter. But I just, I was just, the small little peon in the background that used the Minsky software, which he developed, which is system dynamic software. So I was on the chat, and I typed in the chat, I have a model here. I can't remember. You might remember better than me. Steve said, oh yeah, or whatever, send it to me. And that was that. And then, of course, he sent it. I got a reply. I sent it to his email. And then I got a reply with a quote, and I don't know, can we swear on this show?
I can't in good faith say you can. I'm gonna say, like, there's nobody in the room or back. No, just wait. This is a good explanation. I'm gonna say, out of respect for whose house that I'm in, that it's just not allowed. Like, I know it's not allowed, right? So I'll be saying no. Sorry.
Yeah. Okay. So Steve's words were, "Duck a duck." Okay.
Yes.
That's what he
with an
he
F
sent
in there.
to me. Yes. Now, if you watch,
that's not against the rules.
Yeah. No, that's actually how my autocorrect on my phone does that.
Yeah. So we're not. Yeah. So it's censored by brought to you by Grammarly. That was a new sponsor here. Grammarly. We have an algorithm named after us. Yes. It's the duck a duck with an F.
So that's kind of the story with Steve. Great joke, Daniel. And for everybody watching, Daniel and I do a live stream together. So
this comes pretty natural. Yeah, well, entertained.
I'm entertained by Dan's dad jokes, which there's a lot of them. So, and I have to kind of move the conversation on sometimes. Yeah. So I sent it to Steve, and I think it was the following week you had me on the live stream, which was the start of my live stream career, essentially. Yeah. And I often go back and watch that live stream, and I was all stiff like this, and I thought I had to really emphasize that interest rates may affect aggregate demand. I was not myself, just because I was in front of an idol, essentially, for me, and I even idolized you at the time until I got to know you.
Yeah, that's exactly. I have that effect on women all the time, right? I mean, it's just been the pattern throughout my whole life, right?
Daniel, my wife loves you. So yes. I don't know why.
Many wives do love me, Jai. Oh, geez, I shouldn't have said that. I'm on a religious show.
So anyways, we'll continue. I'll move this along. Again, Dan's dad jokes. So you had me on the show the next week. We did that. And from then on, I basically intertwined with the Steve Keynes brand. I started creating demo models for the Minsky software. Started a YouTube channel, went back onto social media. I'd quit social media back in 2017. Just had enough of Facebook. I had enough of Instagram. I swore I would never go back on it. few years later, I'm back on Twitter, and now I have a YouTube channel.
Yes. Ty, I got to back up a little bit. We'd love to do things at the beginning of the show, and I know we're at like a quarter past the show, but we do like on this show to ask you about your background. How were you raised?
Sure.
Protestant, Catholic, atheist family. What part of the country did you come from? Your roots, like what sort of background can you give the audience?
I can give you a very in-depth background. And I was actually talking to this with my mother-in-law today because I said, oh, you know what? I'm going to be on a faith-based live stream. And I think they're going to want to know what my background is with faith. So I can go back. This has to kind of go back a couple generations. My great-grandmother, I'll first say I was brought up by my grandmother. Long story, but she raised me. Her mom, which is my great-grandmother, was a devout Catholic. So they went to church every Sunday. Their household was very faith-based in the Catholic confines. And that went on. And then to my grandmother's generation, she took that religious-based kind of view and brought it into the household that I lived in, but she didn't go to church on Sunday. In fact, she was somewhat anti-institution, religious institution. She didn't believe in some of the structure of the church, and specifically the Catholic Church. She wasn't anti-belief, believe in a higher power, believe in God, but she was not into the institution. So that's the type of religion that rubbed off on me. And unfortunately, growing up in that environment, the in-between, you're either religious or you're not. I was in that in-between that my idea of faith developed into, well, maybe not. And of course, I think for everybody, faith is an evolution. I believe, this is what my belief is, that we could be, we could be a marble in a drawer and there is a higher power that I don't understand. That's where I am with faith. There have been points in my life, really dark points in my life, where I literally turned to what I envisioned God to be and prayed. I don't know if that's selfish on my part to turn to a higher power and exploit it because I'm feeling bad. And then when things are going well, I'm an atheist. I don't know if that makes me a good or bad person, but that would be my relationship with faith in itself. So there's a distant connection through generations that's fading over time.
Wow, that's a very fair and honest explanation, right? I can appreciate that. Okay, we're gonna go to a commercial break, and when we get back, we're gonna bring Wade into the conversation. How does that sound?
Oh, it sounds wonderful.
Okay, hold on, everybody. I'm gonna get it going.
And welcome to Something or Other Publishing, or as our friends like to call us, Soup. Soup is a platform that connects authors, readers, and service providers in one convenient place. Choose Soup if you're an author with a great book idea and you're looking for a publisher offering hands-on coaching in some of the best royalties in the business. Or if you're a reader who enjoys engaging with celebrated and emerging authors. We already have over 3,000 of them, and more are joining every day. You can even win free books by voting on their book ideas. Or maybe you're a service provider and you're looking to engage with over 3,000 authors. We're here to help. So whether you're an author, a reader, or a service provider, you're in the right place at Soup. Contact us at help@soupllc.com to learn more.
Hey everybody, we got some friends in the room here, and this presupposing because I know Wade just instantly is going to be friends with Ty, because he's so likable, and I'm so happy to have him here. But Ty, I want to introduce you to Wade. Wade, I want to introduce you to Ty. Go.
Well, Hey everyone, I just texted, hey, I just popped in to see what was going on. Don't put me on the spot. Of course, my requests are always ignored, but I am glad to be here. So, Ty, didn't you and I meet briefly when I crashed a recording that you were doing, or was that someone else?
Yeah, so we all share the same virtual recording studio. So Wade was navigating his way through the studio and came upon my recording studio, and that is when we met for the first time. I've watched your podcast, on and off over the last 6 months. But outside of that, we have never spoken before, outside of that brief encounter during my recording session with an individual that I had on my show.
Well, I am pleased, and I've been enjoying the little banter back and forth, and I appreciate, Dan, having you share a little bit of your background. Where was that exactly geographically that all took place?
So I hail from Vancouver, Canada. I was born on an island called Vancouver Island, which is adjacent to Vancouver, where Daniel lives. Can I tell people on the air?
Oh
where
yeah,
you live, Dan?
yeah.
Okay.
Yeah, I was actually born in Vancouver, and
Oh,
I used to traverse the shores of Vancouver Island back when starfish still existed there.
Okay, wait. I want to have a little test. Now, this is the on-the-spot moment. So quickly, just
here we
like
go.
places you've lived. Boom, 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 boom. Just throw them out.
Places I've lived.
And obviously, we start with Vancouver because you're born there. Okay, go.
Okay, Vancouver. Do you want like a sequence or just
Just
random?
go. Just whatever.
I've lived in Vancouver. I've lived in Zurich, Switzerland. I've lived in Rouen and Strasbourg, France. I've lived in Milton Keynes and Elstree, England.
Wow.
I've lived in Bonn, West Germany, when it was the provisional capital. I have lived in Norrköping and Laxå in Sweden. And a few places in the United States, including my senior year of high school in a tent in Palmer, Alaska, from where I could see Sarah Palin, but I could not quite see Russia because I was slightly farther east than Sarah Palin was in Wasilla.
Wow.
She was a cheerleader for the Whatcom Warriors when I was cheering for the Palmer Moose.
Wow. Well, I thought you actually lived in Russia for a period as well. Or you just
I never
visited
lived in
there?
Russia, but I was in Leningrad when Gorbachev was abducted and the tanks were coming from Moscow and I was coming in from Finland. A surreal moment. I'm always reminded of the sort of Star Wars moment where Obi-Wan Kenobi says nothing to see here and he gets waved through. It felt like that when I was entering Russia because I knew something was going on. This was in the pre-internet cell phone era. I just didn't know how bad it was as we were heading towards Leningrad and the tanks were coming from Moscow, which led to my autobiographical work because around that time in my life, I was challenged, I think it was 3 times by people who just said, "You're lying, you're making this up." I'm like, why would I fraudulently create a life I didn't have? And how dare you deny my experience and my existence? But yeah, I've led a very weird life. Which is why I'm always fascinated by understanding where people come from, because those experiences shape you so deeply in ways that you don't know. And if you haven't processed it, I mean, I'm trying to remember who it was that said, I think it was Socrates who said, an unexamined life isn't worth living.
You nailed it. See, I knew this philosophy was rubbing off, right? Okay, I want to move something in a little bit of a different direction. Ty, do you have a screen share ability of your model? Is that something that you could do without too much issue?
Yeah, I can bring it up here. I have to dig it out of my folder. Let's see.
I have an exciting exercise, I think. So Wade, to give you a little bit of a heads up, but what I'd like to volunteer you for, right, to get you and prime you into the mindset here, is I'm going to get Ty to pull up the model and I want his explanation of the model to kind of follow the layman's, and I'm going to put you into the layman position here from, and it's actually a compliment, right? Because I want you to be able to think, how is the logic being built into the model? And
so go for it. I grasp information that is well presented extremely quickly. And I love,
yeah.
This is like a challenge, a puzzle. I love diving into it.
And
whatever test you're putting before me, I will tackle it.
And I will vouch for you on this because, and it wasn't a rude thing. Wade interrupts me all the time. But what I love about that with Wade,
wait a minute, Dan,
is
how
that,
dare you?
But what he's doing it is affectionately, right? Okay, like my mom used to say when I grew up. She said, I only yell at you because I love you, right? So with Wade, his situation, he's like, I know everything you're about to say, and he's ready to go for it, right? So he delivers, right? It's right. He might gestalt the rest of the whole sentence, but it's unnecessary. He just knows what my point was, so he's agreed. I think it's great. Okay. All right, how you making out there, Ty?
I have I'll have to apologize. I've torn this model down visually. It still functions, and I'm going to show what you know as the godly table to give the stock flow structure. I think that's basically would be a good way to show people what system dynamics is, how it works mathematically. And I'm just going to share it now. Window. Share. Now I know how fickle Restream can be, so I'm gonna
caveat here. I have to actually be able to read what I'm looking at, but let me pull this over to a bigger screen on my desktop setup here. It's a little better.
So basically, I started with a stock flow structure of the model, and what I used what's called a SIR model, and a SIR model is SIR. It stands for susceptible, infected, and removed or recovered. And I expanded that into a SIRD model, which of course has deaths, and then expanded it even further. So I'm going to go through the top row because I have abbreviated names here. And basically, I've created a stock. And a stock is something that accumulates with the flow or lessens with the flow. I'm going to point out the stocks. And so the first stock is I have my stock of susceptible people. I have a stock of recovered people that have become susceptible again. I have vaccinated individuals who have become susceptible again. I have exposed individuals. I have recovered people that have been exposed again. I have vaccinated individuals that have become exposed again. And it goes on. So then I have infected people. I have quarantined people. I have individuals in the hospital, individuals in the ICU, and ultimately you either recover or you die. An analogy you can use in system dynamics is these are all bathtubs. And so if you go down on the row on the side, so the column, you have all your flows. So you have getting exposed, get infected, infected recovered, infected get quarantined, quarantine recover, quarantine gets hospitalized. Those are the flows that go in between the stocks, and it creates the structure of the system. And in the health profession, this is called a compartment model. So each compartment is, are you susceptible? Are you infected, et cetera, and you have the flows that go in between. Then you can create mathematical equations to dictate what those flows are. And so in the case of the pandemic model I built it for BC, Canada. I took in all the data. This is about 9 months into the pandemic.
Yes. Can we pull the screen share down now, or do you want to?
Yeah. Here, let me click the stop sharing button now.
I guess I could have done
well,
that.
So the data is pulled from British Columbia over a course of 9 months or 10 months? What was the parameters of that time period?
What do you mean the parameters?
What was the start date and the end date of that time period of data collection?
I took a data from March 2020 till about December 2020, and then built that into my equations to actually run the model. So I looked at hospital data. How long are you staying in the hospital for? And a lot of the data I looked at wasn't cases that were detected, because if you look at the beginning of the pandemic, there was no detection, a proper detection method. One of the key data points I looked at were deaths. Even though the death metrics changed over time, it was more reliable. And what I looked at
and the suppositions around that were being, the assumptions at the beginning were all flawed and false, right?
I just think there was a lack of understanding at the beginning.
I'm not assessing moral judgment. I'm just saying we now know that we didn't really have a clue what was going on in those first months.
Yes, that's correct.
I have to say, oddly, I would. Oh, go ahead, Ty.
Go ahead, Dan. Go ahead.
I would have to say, oddly, if I recall back, if I remember, I think I actually heard that honest sort of message from, where I am, where you are, Ty, from, Dr. Bonnie Henry. She was the person that would come on, and I felt that they don't really know, but they're trying to make the best decision based on the evidence they had in front of them at the time.
Well, we've had a person on here, Jason Persoff, who is brilliant. We love him. His basic position is that your individual experience is not scientific. And yet I am 100% convinced that I had COVID in January 2020 before it was acknowledged that it existed in the United States. And whether or not I personally had it or not, it has been proven that it did in fact exist before we thought it existed. It was spreading quite extensively before we had the first identified case.
Yeah, no, and I think there's a great deal of validity to not only that it arrived earlier than February, March in BC specifically, because I'm working from BC data, but most
you had a great Chinese connection in Vancouver, right? So when was it that the flights to China were halted, and that was claimed to be a racist decision at that time in the United States? But I had met with some Chinese people over Christmas, which is where I think I ended up with COVID. Christmas 2019.
So we have to look. So the initial wave of the pandemic was the biggest wave, not the second and third wave. We didn't have the detection methods. And a simple first principle finding, without reading an academic paper, is looking at the deaths. The deaths were the highest during the first wave. Now, I know a lot of people, and this was a position of my model, that the waves were driven by the on and off lockdown measures, not new strains, which were minor, made big in the media. Oh, we've got this new strain, and it's changed the dynamics.
Not at the beginning, right? What was the first new strain that was identified? And that was months into it, right?
Mm-hmm. Yeah. So
I basically agree with what you're saying, is that those waves were not driven by strains, but they were driven by, considerable concerted efforts to manage the situation, which would naturally have, caused disruptions in the normal spread.
Yeah. Well, and so mathematically speaking, if you model it in aggregate, there are natural waves in a pandemic.
Right. Absolutely.
You look at those models and you see, ebbs and flows, and generally those flows over time, they level out into an equilibrium. And models demonstrate that, mathematical models, and it's always the first wave that's the most intense wave. Now, the data, when we look at the back data, it shows the second and third wave was the most intense. but that is not very intuitive mathematically. If this truly was an unknown virus that was spreading and we weren't detecting it, the first wave was naturally the biggest.
That begs a major question in my mind, right? Which is, again, I'm 100% convinced I had COVID. We know for a fact that a relatively high percentage of people who came down with COVID were completely asymptomatic.
43%.
Right. Secondly, I had symptoms, but even after COVID was known to have been there, I didn't connect the dots because my symptoms were different. I had zero flu symptoms. Only when I began to learn that there was this stuff happening in your lungs that restricted the flow of oxygen and that they were intubating people because of oxygen, did I realize I had COVID, because I had no fever, no flu, but I couldn't breathe. I would go up one flight of stairs and I'd be gasping for air like a fish out of water. And I'm convinced that I didn't have the flu symptoms because I never had a flu vaccine. And COVID being a cobbled together, I believe that it was, man-made in the sense that it did escape from a laboratory. That's my personal belief. I think there's plenty of evidence that that's a reasonable conclusion at this moment in time. They're still disputed. But so you had different aspects of this virus. And I had natural immunity to some of it, but not to other pieces of it, if you follow me. And so the particular restriction in the lungs, the oxygen flow piece, was the one that I did not have a natural defense against. And that caused me great distress. It didn't land me in a hospital, but I went to see doctors and they took blood samples, which is why I chuckle when I hear, they found COVID in blood samples in Wisconsin in January. I'm like, yep, in my blood samples, right? But at the time, they weren't testing for COVID because COVID didn't exist in the United States. But my point is, my point in that whole thing isn't to talk about me at all, but to talk generally about the hysteria versus the reality of what was actually really happening statistically with COVID. And if 43% of people were completely asymptomatic, then it was never as deadly as it was made to be in the early months. And again, I'm not assigning judgment to that. It's fear, safety, carefulness, natural good reactions.
Well,
can we admit the factual reality of the matter about the degree of danger and deadliness in a vaccine that's spreading throughout the population unbelievably, and 43% have no symptoms whatsoever?
I want to just say what my interpretation of that. I think it's been really honest from everybody here tonight so far, right? I think this is a really great foundation for a conversation. But I found myself either adding to or correcting Wade, what Wade just said, in only one respect. I think if we're remembering it as death count, that's not what I remember they were pushing. They were pushing that hospitals were going to be overrun.
But what does it matter if people aren't sick, right? And people aren't dying. So I get what you're saying, why did we care that hospitals would be overrun? It's because, I guess it's because people that needed to get there wouldn't be able to get there because all the beds would be filled with people with COVID who may or may not be dying, but they're being treated, and therefore the hospital system is overloaded.
Yeah,
fair enough.
Let's start from that foundation, because maybe that was the justified reason to put the fear into people, or to communicate whatever it is, right? I shouldn't have said that. It wasn't intended to do that.
It is certainly a justifiable reason. If that's true, and if that fear is valid, that's reason enough.
Yeah.
To take action, but not at any and all cost. And fear mongering, in my opinion, is never okay.
Well, I want to talk about, I don't know where, like if we're going to describe where in that sort of landscape the fear mongering emerged from, because I'm not saying it's not in the system, right? And that'd be an interesting thing to say. Ty, how would we identify a something pervasive or destructive into a system? Like, I don't even know if you would mathematically know how to set up that in a model. Is that, how would you tackle it if somebody said, I'm going to, give you $1 million to model that? How would you set it up?
I think for the first thing we need to really identify is the distinction between the media and the healthcare profession. So the healthcare profession was serious with its concerns that hospitals would become overwhelmed because they knew logistically, as Wade said, they were not going to be able to treat other people if they're overwhelmed triaging COVID patients. So that was a legitimate concern from health professionals. The media, as we know,
and there was
in this
evidence
age,
from Italy, right? There was evidence from Italy of that happening.
So we know the media in our day and age tends to amplify things for ratings. We've lost the local stories that we were used to getting, and we now get amplified stories for ratings. And the media is hugely, in my opinion, responsible for creating the hysteria. And I wouldn't say that they created it by being, they created it by picking data slices. And one of the biggest things was saying the amount of people that have died in total. So that number always grows. It doesn't ever go back down. So, one day we're at 5,000,
Right.
then we're at 7,000, right? So the media and the way they portray the situation unfold responsible for creating that hysterical aspect of it and taking messaging that the healthcare profession was trying to put out responsibly, amplifying it as well. So any of the worst case scenarios that the health profession would say, the news would take that information, pump it up in the news. And of course, that was the beginning of the pandemic for us. A bunch of, I won't say unintentional misinformation, but unstructured information going out by the media to gain ratings.
Well, and let me
'Cause
have you pause, and I want to address that one point right now, and that is that as you were showing your model, I had various questions about bias, right? What is the intent of this model? For which purpose was it constructed? Because anything that's massively complex, wherever you choose to put the microscope, right, is going to give you a partial view, right? So in this case, if it's true that the healthcare industry was concerned about hospital overflooding, and they naturally were invested in making sure that they maximize the amplification of that message. Now, the media did the dirty work, but the hospital system was biased towards having the media do that work to the point where in America, facts have been uncovered wherein people were encouraged, incented, coerced into reporting data that created that image, that created that impression around the hospital beds. And then you had this war going on where individual reporters were going around the country showing hospitals with empty parking lots, showing hospitals with no patients in it, to provide a counterpoint to that narrative. And now you have the amplification of echo chambers with agendas that are trying to drive this narrative versus that narrative. I mean, those things are true in my opinion. I'm not even commenting on right or wrong now. I'm just saying objectively this happened.
Yeah, I can't argue with any narratives being out on the left or the right, especially down in the America. That's just a given for any topic. That's just the reality. As for my model, I looked at a lot of data-driven things that I thought were reliable pieces of data. For instance,
Right.
hospitalizations. Now, granted, we have to assume that initially hospitalizations, some of them may have been counted as COVID, but weren't COVID. but I used the most reliable information I could use as statistics, including deaths. And again, we have to assume that some of those deaths weren't actually COVID deaths, but were counted in the heat of the moment as a COVID death. And then I
Deaths
related
and even deaths with COVID versus deaths from COVID. So, for
Yes.
example, from a data perspective, Dan and I had this discussion a few days ago around when all the dust settles, and we look back from the perspective of 2025, we should be able to get a clearer long-term view of the total deaths of the population over time across a 10-year period and analyze the reality of, let's call it years of life lost, right? Life expectancy. Because we know for a fact that age was a comorbidity with COVID, right? And so a 90-year-old dying of COVID is by definition less years of life lost versus a 10-year-old dying of COVID. And depending on the situation of that 90-year-old who may have been months away from death anyway and would have lived to 90 and a half without COVID, that gets flattened out over a period of 10 years, and we can do a better analysis of the actual impact of COVID really.
Hold on that just for a minute, because I'm going to reverse the order of our sponsors. I'm going to put an ad up, and when we come back, we're going to actually hear what Ty has to say about Wade's framing over a 10-year period of total deaths in the world and broken down probably by country. Okay, so Ty has a few seconds to think about that, and we will be right back.
The Healing Connection, a partnership for your health. All physicians, particularly those in primary care, are under constant pressure from administrators to be more productive, despite caring for more significant numbers of patients with increasingly challenging health concerns. They also force physicians to spend less time with each patient. While expanded numbers of patient encounters benefit the bottom-line administrators who are constantly watching, the result can lead to frustration and anxiety on both sides, with physicians sensing they may have missed something during their evaluation, and patients feeling their concerns were not acknowledged. This book addresses this current situation in American healthcare, showing how a strong patient-physician relationship can help overcome the obstacles imposed by entities seeking to commoditize healthcare delivery in our country. Dr. Drew Raymanyanti firmly believes this solid and trustworthy doctor-patient connection is the key to superior and more cost-effective outcomes. The Healing Connection is now available for pre-order at soupllc.com. Scan the QR code to secure your copy today.
Okay, we're back. Ty, what's your answer?
I can't answer that question because we need more time for how that affects. So the life expectancy has gone down in the United States over the last few years, but I can't qualify that as, is that because of COVID, or is that because of separate social stresses caused by COVID? Is that a whole nother facet of the American lifestyle, or are they in a decline health-wise? I think, like Wade said, we need a couple more years to really see analyze the impacts of COVID as in aggregate.
I guess the interesting thing would be that,
and also going into the point of demographics, we need more time to study the data. And obviously, this clearly impacted elderly people a lot more easy, if that's a way I can say it.
Yeah.
They were a higher risk population to be affected negatively by COVID, and i.e. deaths, than the younger population. But that goes with saying with any illness, the flu will kill your grandma or grandpa if they are not, drinking their fluids, and taking care of themselves a lot easier than it will kill a younger person. We need more time to really look at that data. So I don't want to venture into any guesses in that department. My model was more focused on were the lockdowns effective at flattening the curve? That was the data I was looking at. What was driving the individual waves of the pandemic in aggregate in a specific region? And I made sure to, in my model, to constrain it to the BC health region, because we were under all the same health protocols, versus an aggregate national model where each province has its own mandates. And this would be the same down in the United States. You have different state rules, different municipality rules. So that was kind of my area of research with the model. You may ask your question now, Daniel Sanderson.
No, I think that's worth pausing and just saying, what are your thoughts, Wade? Because I mean that probably all sounds fine, right? Like,
oh, it's wonderful. My thoughts are this.
Mm-hmm.
In my life, the way I approach things is, and this is why background's important. I'm going to share an anecdote to try to frame my response before I give it, because I don't want people to just react to how I'm going to respond. I want them to understand where I'm coming from. When you're 3 or 4 layers inside the system of systems, it's like a house of mirrors, right? You know the analogy of the onion. It's layers and layers and layers. When you're deep inside the onion, when you're in the matrix, you don't even understand what the real questions are, right? So I've always and because I was in the system, I was put in an orphanage. I was sent from Sweden back to my alcoholic mother, who had married a man she met in a bar for the express purpose of deceiving the courts in Sweden into thinking that she had a better home for me and my 2 sisters. This decision was made by the Supreme Court of Sweden. And it was a wrong decision simply because of biases and perceptions. And it was so obviously wrong. And I could see it from the inside, and I was impacted by it, but I was a voiceless child who had no opportunity to say, wait a minute, this is bullshit, right? And so I in my whole life, I've always wanted to climb to the top of the mountain and survey the entire landscape to find out what are the really big issues here. And are we causing more problems by treating symptoms versus getting to the underlying root causes? And you know this, Ty, I can imagine from your model, root cause analysis, asking why 5 times, getting to the root cause of something. So now, this is where I'm coming from. I am not coming here to argue or create a political weaponized statement. But if what you said is true, which I 100% believe it is, that yes, the flu can kill your grandmother and it's unlikely to kill you. And yet some young people can die of the flu, right? How much worse than the flu was COVID really, right? And we have for decades had the A/B flu shot, right? Because they don't know which variant of the flu that they're trying to protect against. Now, taking a step back, what I know about the immune system, what I know about how our bodies reacts to, immune weakness, or not weaknesses, but things that attack our immune system. I believe personally that the flu shot has weakened our herd immunity over time. That we are creating people who are less resistant in a vicious cycle of having to depend on outside stimulus to keep our immune systems protected, right? And all that does is weaken us, and we're guaranteed to have some wave come through, like major manufacturing units where they have 50,000 cows or 50,000 chickens, and occasionally they have to kill them all because they've been pumping them full of antibiotics and this and that and treatments, to keep them alive in this condition. You follow me? These are the issues that really I believe we should be looking at. And with COVID now, big picture, how much more dangerous was it than the flu really? Right? And so the effects of the lockdown, this is where I'm going. Now I'm going to get to the point. The effects of the lockdown, whether or not the lockdowns were effective in the spread, right? Or what was the term you used? The model detects whether or not the lockdowns had an impact or were effective. You follow me?
Yep.
The answer to that could be a resounding yes, but I would still say, well, wait a minute, let's walk this back. And then now you have to look at the big societal effects of the lockdowns, as you hinted at, as you alluded to, which you're obviously aware of this, the opioid epidemic, right? The psychosis, the school shootings, even, which there's a lockdown, antisocial, social distancing input into even those societal evils. The Germans have a word, it's called Zivilisationskrankheiten. It means literally civilization diseases. What are the civilization diseases? They are the diseases that don't exist outside of civilized countries. And they are the diseases that enter into the population because of our poor lifestyle and our poor behavioral choices when we end up in cities and we end up in the culture and the system of systems that come in at this level of civilization. All of these big questions are important, not to minimize your work, the work of the hospitals, but the whole system of systems needs to take a step back. And what are we doing? How are we seeking to turn human beings into a vast cattle farm and pump us full of antibiotics and give us our annual injections, and everybody has to go along with this, and everybody has to be forced. It has to become a monoculture of non-natural resistant things that is then susceptible to that outlier that comes in and wipes us all out.
There's a lot to
you get my
unpack
point?
there, Wade.
Right.
I get your point. So there seems to be a
one last comment, which is why hang on, which is why I'm an advocate of taking a really thoroughly objective look at the various petri dishes, such as Sweden being so critically important. And rather than villainizing Sweden is an opportunity to objectively look at a nation that took a different approach, and with a positive mind rather than a castigating mind. Look at what they did and what actually happened holistically.
Yeah, it's very tough when you're venturing into a lot of inequality and division in our, because you touched on it with school shootings and how we react, and this is actually discussions I've had, that we seem to be, in at least our capitalist worlds, and I of course study economic modeling as well, we seem to be approaching our issues with division and literally separation, whether it's the criminal justice system, whether it's health matters, whether it's economic class. And you ventured into that, which is hard to really tie into, the pandemic, but I can kind of tie in, should we be apprehensive of what we jab in our arms? Yes. Was the unroll of the vaccinations for COVID too fast? Yes. Was it necessary to have the vaccination during the height of the pandemic? Unknown. More study needed.
Well, first of all, we didn't have it during the height of the pandemic, right? Again, based on your model we had and the waves.
We had it a year into the pandemic. And if we stretch this out, if we consider it a 3-year-long pandemic, which is subjective, we had it during the pandemic.
When did the vaccine first begin to be rolled out?
So
I don't recall specifically.
Here in BC, it was January 2021. Some elderly people were qualifying for it in December 2020. The vaccine was beginning to be manufactured in October of 2020.
Okay, so it began to be rolled out in certain societies to certain populations more than a year after it began spreading, based on what we now know. So when was really the height of the pandemic, given what we also now know about the rapidity of its spread and the fact that we had no testing for it? And by the time we even remotely figured it out, nobody was even being allowed, or certainly not encouraged, to determine whether they had already been exposed, right? To this day, I'm not even aware of where I could go to find out, did I ever actually have COVID, right? And can we even know now, COVID versus a vaccine versus a booster, to know what is the percent of people who had COVID before the vaccine was ever administered? So again, these are big questions that I think are important. No one's even thinking to ask them. We're just rolling forward based on a bunch of flawed and potentially inaccurate assumptions.
I gotta stop you there. There's about 100 academic papers that have shown, and more research is needed, that having the vaccination reduces your chances.
You're missing my point. You're ignoring my
severely
question.
sick.
How many people had COVID? When you say those studies, I'd like to know, how did they know that those people hadn't already had COVID? Where was
relevant.
the test?
It's not relevant.
How is it not relevant if I had COVID in January and I was later vaccinated, and later I'm part of a study that says the vaccination protected me from getting sicker? That's utter bullshit if that's true. If that's true, that's ridiculously full of bullshit. Right?
Most of the science says that natural immunity lasts for about 6 months. So your antibodies, which were created by being actually infected. So most of the data so far says around 6 months.
Well, look, wait. So I got COVID in February. Perhaps I was even asymptomatic. And then I have immunity from it for 6 months. And then I get it again. Who gives a shit, right? I'm already not affected by it.
It doesn't matter, because if you do become affected by it, you become a burden on the healthcare system.
I was asymptomatic. I didn't even know I had it. How am I a burden on the healthcare system if I don't even know I had it?
Here's the thing. If you don't know you had it, then you don't have any conclusive evidence to say it matters or doesn't matter. You could have become a burden on the healthcare system.
How was I a burden on the healthcare system if 43% of the people are asymptomatic? You're saying they're a burden on the healthcare system. Why exactly? How exactly?
You are claiming that you thought you had COVID. You're not claiming that you decisively knew you had COVID.
I know I had COVID. I don't have proof.
How?
But it does. Look, forget me. Forget me. You said 43% of the people are asymptomatic. How are they a burden? How are they a burden on the healthcare system?
I didn't say the 43. I said that you did not know if you had COVID or not.
I had COVID, but it doesn't matter. I can't prove it. So let's move on. 43% of the population were asymptomatic. You said that. How are they a burden on the healthcare system?
Those people aren't a burden on the healthcare system.
That's my point. So anyone who had COVID and had no symptoms is not a burden on the healthcare system. But later, if they got a vaccine, later if they got a vaccine, well, they had some symptoms. And how?
Okay, what about the people that were hospitalized?
That's a completely different discussion.
It's the exact same discussion.
No, I'm addressing the studies that you referred to. You referred to studies that show that people who got the vaccine benefited, however that was. And I'm saying I'd like to understand the big picture. How many of those people who got the vaccine had COVID already. I think that's relevant to the outcome of that study. Because was it
wait a minute. I can interrupt because I know that kind of it was coming together like this a little bit, but I think I can I can drive a little bit of like some thought into this. So let's go at it from a different way, Ty. What would the data and the reporting have to do in order to make Wade's suggestion of identifying people who have already had COVID when it came time to getting the vaccine, right? So how would we have got that data?
No, Dan, please, let's back up because I'm not insisting on anything here. Wait. Let me say this. I'm asking Ty an honest question. I don't care about the answer. I really don't. I'm not attached to any outcome here. If I'm wrong, I'd like to know I'm wrong. To me, I cannot get my head around that it wouldn't matter. But Ty, if you're saying, look, it doesn't matter at all if somebody had COVID already and then they later were vaccinated and were in a study, help unpack that for me. Exactly how does it not matter? Because to me, it would seem that it must matter.
So there were studies on people that were recently infected naturally by COVID through natural means, which is the only way, in studies that were vaccinated 1 month after, 2 months after, 3 months after, 4 months after. But the assumption is that after 6 months, your natural antibodies are gone and you can become reinfected. That's where the data stands now. So any further out in that time horizon, science is not looking at because it does. Those people are susceptible again to get COVID.
Right. So okay, understood. Completely understood.
You're touching on a good point about what are the effects if you've had COVID and then you go get the shot. What difference does that make? And now there is evidence that you have no difference because you already have a natural immunity 3 months after.
Right.
Okay. But not everybody had COVID 3 months before they got the shot. So the idea with getting the vaccine was it reduces the chances if there was another wave, and granted, we didn't understand how these waves were developed properly, but if there was another wave, that there would be a core amount of people that were vaccinated that would help stem an overwhelming effect on the hospital system.
Right. I get. Okay. We've really fleshed out that is one of the lenses through which people are choosing to create models like you did to look at this question. But what I'm saying is this: we now know so much more that we didn't know. I don't know when or how, some of those studies were made, when they were made, what we knew at that time. But if you're creating scientific studies and then a year later you learn a whole bunch of new things that you didn't know about factors that seem to bear significantly upon the results of your study, but you don't want to talk about that at all. And the whole topic of natural immunity was one that was suppressed, swept under the carpet, denied. Nobody wanted to acknowledge the reality or the fact that there is such a thing of natural immunity. And there are all kinds of reasons why, these kind of fear-mongering reasons why. Oh, you want your grandmother to die so that we can have natural immunity, natural herd immunity? You want to kill off millions of people? No. I just want to accept the fact that there is such a thing as natural immunity. We now know that 43% of the people that had it, they were completely asymptomatic. They had natural immunity for a longer period of immunity than the vaccines gave them immunity. And people that had the vaccine were more likely to get it, and they were also still spreading it. So every assumption about what the vaccine was supposed to do from the beginning was wrong. This idea that, it protected us from getting sicker, that was introduced much later after they'd already rolled out the vaccine and forced the jab on everybody. Wade. It was. It absolutely. Oh, I know.
You were not
Look,
reading. You were not reading the scientific papers. You are listening to a media's point of view, and essentially at this point, this is hyperbole.
I am discussing what the individuals who went and got vaccinated knew and understood at the moment in time they went and got vaccinated. My wife
Okay.
is a healthcare worker. She was one of the first people that were vaccinated. At that time, the vaccine was still being touted as a classic vaccine. This vaccine will help prevent you from getting COVID. And when
Who
you
was
get it,
touting that? Wade, I need to know who was touting that.
that was the available information to my
From
wife
who?
and me and my family from any source that we were looking into. You could say that there was some scientific paper somewhere, but that's not relevant if the population wasn't being given that information.
I blame
And,
the media myself.
you can blame whoever you want, but the fact or the reality of the matter is that the people that went on and got vaccinated were getting vaccinated based on that understanding to 90%. And anybody who began to try to talk about anything else was labeled a spreader of lies and misinformation.
Sure.
I was personally reported in a letter
Sure.
to a national organization as a spreader of lies and misinformation because I was trying to get information at that time. So don't tell me or don't blame me for not having the right information at that time. Nobody was allowed to get any information that wasn't the officially sanctioned narrative. And if you tried to get it, you were labeled a tinfoil hat conspiracy
wasn't.
theorist.
I wasn't. So this it comes down to a personal, which I feel really bad for you. My wife is also
Oh,
a
no,
nurse.
don't make it about me
So-
personally. We're talking about millions of people, not just, oh, poor Wade as one person. The vast majority of the population was in this situation.
Yeah.
And if somebody says, well, I had information, it's just the exception that proves the rule. And it's revisionist. I'm sorry, because the reality on the ground was everybody
No,
was
I
basically being
have to
forced and
disagree.
fired.
Wade,
You were being fired for not getting a vaccine. My niece up in Canada and her husband both lost their jobs because they didn't get vaccinated. In British Columbia.
That there are bad parts of the way we manage the pandemic.
And my niece was in the medical field, right? So,
but you have to understand,
come
we
on.
had a choice. We had a choice with limited information. Do we risk having the healthcare system overwhelmed? And we know the consequences of an overwhelmed healthcare system would be dire for people that didn't even have COVID. We didn't have all the available
So
information.
the end justified the means? The end justified the means? I mean, what about the trucker strike up in Canada? What was that about?
That's
trucker
kind of separate
thing.
The trucker strike was separate from the issue of hospitals becoming overwhelmed.
Not strike, but whatever, protest.
That's kind of going in a different direction.
It's not. Ty, what I'm addressing is your statements that somehow I and a few others weren't informing ourselves, but it was generally well known that this was true. No. You had massive uprisings and protests because that was not true. What you're saying is just tactically not true. You could point to some theoretical piece of data to support that position, but it wasn't the reality on the ground for the vast majority of the populations in America or Canada. That there was,
like I admitted, the media messaging was terrible. It was terrible.
Well, I can't speak to Canada, but in America, in America, you had Dr. Anthony Fauci, who represented the science, and he was the official government mouthpiece, right?
Mm-hmm.
So it wasn't just the media. He was the head of the CDC, and he was the one communicating and creating this narrative that was being amplified by the media. And he never ever got up and said, the message of the media is incorrect, until long after the fact, when suddenly there was egg on people's faces and they had to spin it differently. Then of course, oh, I never said that, right? I never made the decision to lock anything down. I never made the decision to force anybody to get the vaccine, he said. It's technically true. Technically true.
That's unfair to people like Fauci. When you can mention things like this in hindsight, we were in the middle of a health crisis. We didn't understand if it was going to be severe or not. Okay, there was a legitimate concern by healthcare professionals that it could
completely agree. I completely agree. I understand the reasons and the premise, but we have an obligation to assess what happened, and there should not be COVID amnesty, which some have advocated for. There should be accountability. There should be accountability. And I'm not saying Fauci did anything wrong. I'm saying you can't just blame it on the media. That's all I'm saying. I'm saying that the media was parroting the narrative that was being issued by the health agencies. It's very convenient for the health agencies to blame the media for exaggerating their message, but they didn't do anything to correct the exaggeration. They really didn't.
Yeah, that would be interesting if the CDC did come and say, actually, it wouldn't have done this, and we have evidence that was the case. I mean, I somehow intuitively don't think that's the way the CDC works, right? I mean, but I think what Wade's kind of inevitably alluding to is that there's a bias on that side that seems to feed on itself and grow, and just like a physics department volleys for more and more budget every year, sort of thing. Like, I mean, like even not knowing that that's what it does. Right. And I think Wade's ultimately what's that?
Okay, I got you. Which side? For me, I don't look at this from a left and a right perspective, so it's hard for me to really.
Nor do I. I mean, there are these echo chambers and these narratives. That's a fact, but I'm not looking at it from either side either.
Right. No, so I get that. Okay, so let's frame it a different way and say that to the right of me and to the left of me, we've got two social scientists. And I think it's actually...
Wait. Am I on the left side of the screen?
You're on my left.
Wait a minute. Yeah, because I don't turn myself... this is a very interesting thing, because you would never turn yourself around to then stick your entity inside the screen. So this is the difference between my reflected self... Right? So you get what I'm saying, Wade? Right? Like if I'm imagining myself from a first person perspective kind of thing, I can turn myself like this, and I can also look at myself like this. But the actual person is there. Are we playing for an audience? We're going to have to. This is a lesson that I learned from Ty earlier. It's like, this has got to be entertaining. It's like it's a live stream.
I'm enjoying this. I love debate, to be honest. And Wade, this is a respectful debate at the end of the day on a very divisive topic. And we probably come from different viewpoints, but I will say I've watched you a lot and I have the utmost respect for you. And I wouldn't even take the time to debate somebody I didn't respect. So I think I want the audience to know that.
Amen. Amen to that. There's, this is not personal. That's why I said, it doesn't matter if I did or didn't have COVID. There's nothing personal about this topic. My basic premise is this. We are, as a civilization, we are creating ever more complex systems of systems. And we treat symptoms. We do not treat root causes. And the healthcare industry is a sick care industry. The products that are developed, speaking from America, and you can say, well, Canada is very different. That may or may not be true. But speaking from the perspective of the way things are in America, and I've also lived in other countries, the research and development is biased towards treating symptoms. It is biased towards creating products that people will need to use for the rest of their lives, such as annual vaccines, multiple times per year boosters. These are the things that drive corporate profits through the roof. These are the things that people working in those large healthcare conglomerates tell themselves they need in order to cure cancer, right? We need all that money coming in so that we can fund the good work, right? But the good work never comes because the Frankenstein monster that we have created feeds on profits coming in, and the financial people, the CFO, the others are very interested in creating products with a very high ROI, return on investment. A pill that cures cancer doesn't make money, because you can't charge $1 million for that pill, even if it cures cancer. You have to mass produce that pill and sell it for $5 to help the poor people who have cancer get well. And they only need to take it once. I'm exaggerating for effect. I'm oversimplifying for effect. But the products that you need to take every single day of the rest of your life, those are the profitable products. And that's where the R&D dollars go. That's where the focus goes within these companies.
I'm going to give Ty an option here, because we should wrap up the show. Honestly, we've gone 20 minutes over and I barely knew. So we're going to close out with Ty getting the last word. Okay. And it's not because I think the debate is over. It's I liked the use of debate. I actually intuitively wouldn't have called it a debate, but maybe it just kind of felt like that at times. Ty, I'd like you to either respond to what Wade was saying, if I haven't thrown up too much of a smokescreen, or I would like you to explain to the audience how you would, and feel free to finish and wrap that up. Okay, I'd like you to have the last words. I want you to tell the audience, how would you model the subjective nature of experiences, particularly with COVID, or how would you capture what Wade was trying to say in a model? Like, how would you design the data collection and all this kind of thing? So tell me how you would create.
So actually, I'll address, I completely agree with the pharmaceutical industry being profit-driven and looking for a return on investment. That part I completely agree. And if Wade's coming, especially with the COVID vaccine from that perspective, we're probably going to find a lot of common ground there. Okay. And that goes back to, did we need a vaccine? And I said, I don't know. Right? I don't know. And some of that I don't know comes from, there is a profit motive, and especially you see it in Canada as well, from the pharmaceutical industry. That's huge. And they're usually monopolies that hold the market and control the rates for a little powder pill that they compress and sell to you or the government, depending on your situation, for ridiculous amounts of, dollars. So I agree with them there. In my model, actually, I had a component called social stress. So people would become stressed out over time with the mixed messaging of lockdown procedures going on and off and on and off. And there was a degradation. There was a degradation in people actually following those rules. I can look at it for myself. I stopped wearing a mask after a while. I got tired of it. I got tired of the story of COVID-19. So I do have a built-in social stress part. Because it's system dynamic modeling, it's aggregate. So it's not agent-based. It doesn't look at the individuals. So I could never take Wade's experience, which he's been very passionate about. And Wade, despite you saying it's not about you, I heard that story from you, and it sounds pretty powerful. And so I have to acknowledge that on a person-to-person level. It sounds like a crappy situation.
No. One tiny comment here. That experience, it wasn't. I basically forgot about it until I realized, I had COVID. But what that experience did was it shifted my perspective, and it caused me to look at the whole unfolding situation differently. It gave me a different lens. That's all I'm saying. That's the power of that. And what I want to say, though, is it's not a lens that has me insisting that my view is right, but it did cause me to look at it from a different perspective. And I want that perspective to be introduced into the discussion. But I find that perspective is not welcome in the discussion. That perspective is discounted in the discussion. That perspective doesn't get any weight in the discussion. It doesn't allow the discussion to shift to address some of the issues that I see. I could be completely wrong, but I won't know because they're not legitimately discussed. So my passion in having the discussion comes from, I just want to have the discussion. That's all. I don't care about the answer, but I at least want, hey, I've got this fact here and no one's looking at this fact, and this fact is a fact and facts matter, kind of thing. That's all.
I think I also want to leave with the final thought that there was a shaming aspect to people that, like Wade, were questioning the messaging that we're all supposed to. We get this from every kind of issue that comes along in our societies. Somehow there's a right side and there's a wrong side, and the people that are on the wrong side questioning something get named and shamed, essentially. That I don't agree with.
Well, and right and wrong is defined by the majority, right? Right and wrong is defined by the majority.
And victors write the history, essentially.
Exactly.
So, yeah.
Exactly.
There you got it. Okay. Good night, guys. Good night.
Artificial morality. The future of AI is rapidly changing, and with it, the future of humanity. How will we approach this transformative technology? Will we make ethical decisions that shape a bright future for all? Or will we be swayed by greed and self-interest? The world's great spiritual teachings offer a path forward, a way to use the tools we create for the betterment of humanity. They remind us that we are all created in the image of God and that our technological advancements must reflect this spiritual reality. In Artificial Morality, Navigating the Ethics of AI with Spiritual Teachings, we present a vision of hope where technology serves humanity and not the other way around. Join us as we explore this critical topic through stories of inspiration and hope. To submit your own tale of navigating the ethics of AI and become a part of this groundbreaking anthology, simply email us at info@supellc.com.